Now, when it comes to patient engagement principles, we got to start to link the internet to how we're engaging the patient. And this is going to require real change on the part. This is a cultural shift in a big way between providers and how they communicate with their patients. So there are two golden rules you always want to keep in mind as you formulate your strategy for patient engagement. And the first one is patient experience, or if you want to call it patient satisfaction, is going to be your best measurement of how engaged your patient population is. Patients who are engaged have a much higher satisfaction level. Research supports it. As an example, if I'm obese and my doctor helps me to lose weight, I feel better. My costs are going down because I don't have to take that blood pressure pill anymore. I'm no longer diabetic. My clothes, my self-esteem, oh, that doctor's awesome. So that is a true reflection of how engaged your patient population is. And then the second rule is, as you put your strategy together, this can vary by market. It can vary by the types of patients you serve in your own clinic. There is a wide variety between, say, a federally qualified health system and the types of patients they serve versus a private doctor that's in urban central. You know, the patients are going to be very different. So what you want to do is make sure you're soliciting input from the people you serve, from those patients, from the caregivers, where the family's involved, on how that practice needs to work in their communication strategy. Like I said, the better the experience, the better the outcome. And if we have an improved quality outcome, guess what happens to cost? It drops. And this is why the federal government is very much getting into these metrics, and we're seeing it all over policy making. When it comes to patient involvement, on the second principle that you want to consider, some of the things that you may want to do is create an advisory council, or maybe do a focus group on something that you're about to launch. But seek that input, because then as you design your patient engagement process, you can be assured that you will have the buy-in from your patients and they will engage in that process. So just a couple of rules for thought.